Hi, my name's Georgia. I'm one of the vets at Burke Road Vet Clinic, and this is our beautiful clinic dog, George. George and I are going to give you some tips today on putting eardrops in dogs. Ear disease is very, very common, and putting eardrops in can be a little bit challenging. Hey, Georgie. Okay, so first of all, I thought I'd show you a little bit about the dog's ear canal. It's in the shape of an L, and it's also very long. The reason I show you this is when the ear is infected, the whole ear canal will be infected, but it's often difficult to get drops in all the way, and certainly getting them around that corner is a bit of a challenge. Often they just end up here, but the infection's throughout the whole canal and we have to reach the whole way down. The other reason I show you this is that we're all told from when we're little kids not to stick things in our ears in case we hit the eardrum. And I'm going to show you a technique which involves going quite deep into the ear canal for treatment. You can see that with this long canal, the eardrum's all the way down here, so it's much safer in dogs to put eardrops in. You won't hit the eardrum unless you're a very, very long way in. The other thing is, when the ear is infected, it becomes very closed up, it becomes sore and inflamed. So that also presents a challenge for getting the drops in because you haven't got a nice open canal for putting them into. So to help put drops in at our clinic, we like to use syringes. The reason for that is, first of all, that we know how much of the eardrops are going into the ear, and also it allows us to get fairly deep into that ear canal. So you'll have been prescribed eardrops depending on what your dog needs by your veterinarian. Take the lid off obviously, but I also pull the dropper off as well so that we can easily draw up the solution. A dog George's size would probably need about 1/2 ml, but your veterinarian will tell you how much your dog needs. So you can see that's 1/2 ml up to the 0.5 mark for Georgie. Now he doesn't actually have an ear infection today, so I'm not going to put any treatment in, but just so you can see that all working. Now in terms of restraining your dog, George is very mellow, as you can see. Small dogs, if you hold them just in front of you, you can usually restrain them quite well. Or a larger dog, the tendency is usually for them to back away from you. So if you stand in a corner with your dog between your knees and they're sitting down, you can work from behind quite well and usually restrain a dog and put the eardrops in on your own. But George is just going to lie here nicely for us. Hey mate. Okay, so first of all, a dog with floppy ears like George, you've obviously got to lift up the external ear. In order to stretch out that L, you just pull the ear up as nice and tall. It helps straighten out the canal. When you're looking into the ear, you're basically looking for the deepest, darkest hole. There is only one ear canal, and it's usually quite close to the front of the ear. So you put your dropper in to about in George's case, again, you can put it into about 0.5 ml and squeeze in your solution. After you've put the solution in, take the dropper out and give the ear a good massage. So I'll just do it again. I'll use his other ear so he's not too bothered. So say we've drawn up 0.5 ml, lifting the ear canal up nice and tall, looking for the deepest, darkest hole, usually near the front of the ear, and we can put that dropper in quite deep, as you can see. We'd be squeezing the drops in and giving the ear a good massage. And it's always important to give our dog a treat at the end. You'll be putting the drops in probably a few times a day for a while, so we want them to associate it as being a nice positive experience. And if you have any problems, don't hesitate to give your veterinarian a call. Thank you, George.